Hello everyone, I'm Lynda Toussaint, Chief Executive Officer of Unjani Clinic's non-profit company in South Africa. Built on the principles of social franchising, we empower Black women professional nurses to operate and ultimately own primary healthcare container clinics in our low-income communities of South Africa. Through task shifting to skilled nurse practitioners, we use scarce skills more appropriately. Enhancing access to quality, affordable primary healthcare that complements the public facilities in the communities in which we operate is our main aim. However, permanent job creation and the establishment of sustainable micro-enterprises that provide real social value to their communities are other important outcomes of the initiative. Conceptualized in 2010 by Dr. Ian Barton, there are currently 94 Unjani clinics operating in South Africa today, including 2 mobile clinics serving surrounding villages in rural parts of our country. Our target market is the 15 million odd employed uninsured population of South Africa, which is approximately 30% of the population who are currently reliant on government for their healthcare needs. We've just celebrated in excess of 2 million patient engagements through our clinic network since inception, and our philosophy is to make a difference, one patient at a time. I've been asked to speak on the topic, what would it take for universal health coverage to be achievable for developing countries? And how will the use of technology help attain this goal? It's important to understand what universal health coverage means for context. Universal health coverage is firmly embedded in the WHO's Constitution of 1948, declaring health as a fundamental human right, and it is now embedded in the Sustainable Development Goals. According to the WHO, universal health coverage means that all people have access to the health services they need, when and where they need them, without financial hardship. This includes the full range of essential health services, from health promotion to prevention, treatment, rehabilitation, and palliative care. Universal health coverage is underpinned by 3 key ideas: equity, quality, and affordability. At the present moment, at least half the world do not receive the health services they need, and more than 100 million people are pushed into extreme poverty each year because of out-of-pocket spending on health. Universal health coverage should be based on strong, people-centered primary healthcare, where good health systems are rooted in the communities that they serve and should aim to prevent and treat, but also aim to improve well-being and quality of life. Universal health coverage measures include the percentage of a population that can access essential quality health services. This is called service coverage, and this should increase over time. And the percentage of the population that spends a large amount of household income on health. This is called financial protection, and that should decrease over time. The Lancet measures these as the UHC index. Another important measure is equity. Who's being left behind? Where are they? And why are they being left behind? So let's have a look at developing countries. There are various definitions of developing countries, but many now refer to low-income or lower middle-income countries. They have a low GDP per capita or a low gross national income per person, and are often defined by the country's economic output, which is often an agricultural and less industrialized country. Whatever the definition, the inclusion of low-income or poorer countries is standard. And this adds to the burden of achieving universal health coverage, as the country already has a limited budget and several components to consider when managing services in that country. According to the World Bank, the major health challenges for developing countries remain maternal mortality, child and infant mortality, high fertility, adolescent fertility, mental, neurological, and substance use disorders, and of course, the burden of infectious diseases. And one cannot look at these health challenges in isolation. Think of the iceberg model, which reflects the underpinning issues, which include things like lack of access to safe water supply, inadequate sanitation facilities, occupational health and environmental pollution, strained national finances and inadequate systems, and lack of human resources, medication, and medical systems. Realistically, achieving universal health coverage would require a perfect world, one free from greed, corruption, poverty, hunger, war, and natural disasters, often faced by developing countries. And even more realistically, achieving universal health coverage as defined by the WHO will require systemic change, significant health system strengthening, improved and robust financing systems, the availability of the right health workforce and the resources within that workforce, which according to the SDG and the UHC targets, an additional 18 million health workers are needed by 2030. A patient-centered or patient-focused care model needs to be implemented. A health system free from political influence and agenda. Equitable access for all. And integrated care, focused on need rather than programmatic focused or siloed care. Investments in quality primary health care will be the cornerstone for achieving universal health coverage around the world. Primary healthcare services are a fundamental element of universal health coverage, yet research warns that if current trends continue, up to 5 billion people will still be unable to access healthcare in 2030. Maternal and child mortality remains high in several parts of the world, and more than a fourth of girls and women in sub-Saharan Africa cannot access family planning services, fueling unplanned pregnancies and maternal, infant, and child mortality and morbidity. The COVID-19 learnings alone have highlighted severe shortcomings in healthcare equity and access, even in some of the most developed countries. Lack of funding to acquire vaccines for many developing countries is a typical indicator of where we are on the journey to universal health coverage. So what are we to conclude? Is there no hope for developing countries and the achievement of universal health coverage? The World Economic Forum published an article by Edward Booty, the CEO of Reach 52 in 2020, in which he highlighted 9 reasons why universal healthcare will fail. This is obviously off the back of learnings from COVID-19. So the first one is the penetration of financial services and mobile networks is too slow. So digitization can power transformation in health, but it requires connectivity, particularly in rural, lower income and poor areas. The second item he highlights is the availability of medical resources and human talent in rural areas. Rural areas remain understaffed and the system is effectively broken. Remote care and telehealth are the only ways to really tackle this problem. Thirdly, misinformation, myths, and deeply ingrained cultural beliefs. Use of accessible quality health services in rural areas requires efforts to unpick complex cultural norms. The fourth area he highlights is overcoming corruption and regressive practices. This unfortunate evil underpins many issues faced by developing countries. The requirement to pay government officials in order to help their country access affordable healthcare is unimaginable. Fifthly, regressive legislation is hampering innovation, and flexible and adaptive health regulations are enablers. So COVID-19 has highlighted things like, example, e-scripting prohibited in certain countries. Diagnosis without in-person consultation was disallowed, all forced to be rewritten to enable patients access through technology under COVID-19 conditions. The next item he highlights is that too much capital is spent on rebuilding yesterday's health systems. We need to be reinventing health systems for tomorrow. Partnerships with innovative social enterprises must be embraced. Provider-led, unintegrated legacy health systems are costly and need to be done away with. Low government spending and an inability to collect tax revenues is the next issue he raises. As healthcare needs become more complex, more money will be needed. The low middle income countries' inability to collect taxes has to be resolved. Then balancing purpose for profit, a need to focus on more than just the bottom line for large organizations, to the provision of social value is critical. And then finally, it's not just a healthcare industry problem. How our society and economies are developing through westernized influences will create challenges to the sustainability of health systems and drive spiraling costs. Lifestyle diseases are on the increase: diabetes, hypertension, obesity, and with them can come uncontrolled health expenditure if the disease is not controlled. A multi-sectoral approach is critical to achieving universal health coverage. And by 2030, the growing financing gap for universal health coverage is evident. It's first of all going to be insufficient. By 2030, the gap in financing universal health coverage in the 54 poorest countries will be about $176 billion per year. It's inefficient in that 20 to 40% of health spending is being wasted. It's inequitable in that people in developing countries spend $500 billion each year on out-of-pocket health expenses. And this pushes 100 million people globally into extreme poverty. We have to act now. The emerging challenges like aging and chronic diseases will drive health costs even higher. And pandemic diseases and outbreaks like COVID-19 cause health and economic crisis. Technology has to come into this. And as I mentioned earlier, technology can drive significant healthcare access for millions, but it requires a different type of access to communication networks, data, and affordable devices. In addition, the ability to measure impact in achieving universal health coverage will require a unique identifier and a single patient record, and integrated systems that need to be developed to achieve this. Increased use of point-of-care diagnosis for quicker analysis and diagnosis. The use of telehealth, health bots at home for home care and education. Increased implementation of video consults in rural communities, bringing access to a multidisciplinary team via technology. Access to virtual specialist consults using Bluetooth technology, ultrasound, ECGs, remote analysis of blood and x-rays, and drone delivery of essential medication and blood sample collection. All of these systems exist. They are all in use, but we need broadened access to them in developing countries in order to make an impact. I honestly don't expect to see universal health coverage in my lifetime. Given all of the challenges developing countries face and would need to overcome to provide universal health coverage, and not without significant systemic change. But as Desmond Tutu once wisely said, there is only one way to eat an elephant, a bite at a time. And with this in mind, and the enormity of the challenge that faces developing countries and the world, I look to the achievement of universal health coverage in the same way as the Unjani clinic philosophy. Just make a difference, one patient at a time. Thank you.